Miss James is a 75-year-old female who seeks care today for a change in the quality of her lower chronic back pain. She reports that she had a motor vehicle accident approximately 26 years ago, which was the onset of her chronic lower back pain. But in the last 8 weeks, she has seen a change in her chronic lower back pain from a chronic achy sensation to now a tingling, burning sensation that she describes as ants crawling on her skin, which radiates from the lumbar area of the spine to the posterior, anterior thighs bilaterally, as well as the buttocks. She reports this pain to be about a 5 out of 10 on the severity scale. At its worst. It's aggravated by walking and position changes and relieved by sitting, resting activities, and 650 milligrams of PO Tylenol as needed. She says that it does not change with time of day. She believes it to be her arthritis, although she reports not knowing what kind of arthritis diagnosis she has. She was never told, and that it is affecting her ability to leave and do activities outside of the home. As far as her past medical history, other than the arthritis diagnosis, she does not report any other diagnosis from a provider. She does not take any medications prescribed from a provider. The only additional medication she takes over the counter is Benadryl, occasionally to sleep at night. And she has no allergies to medications. She has some familial history on her mother's side of arthritis as well, but again, she does not know what kind of arthritis her mother was diagnosed with. And both parents have a history of tobacco use. She herself had a very remote history of tobacco use. Otherwise, she is an active individual. She walks 2 miles a day without any history of skeletal deformities, other autoimmune history, or any history of cancer or treatment for cancer. On a physical finding, her vital signs were stable. Her abdominal examination was unremarkable. She does have right-sided quad weakness, was unable to toe walk, and had diminished deep tendon reflexes of the Achilles bilaterally, 1 out of 5. And these findings are concerning for neurological changes, which the working diagnosis here related to her symptoms, her past medical history, and her physical findings is spinal stenosis, with the differential being sciatica, herniated disc, musculoskeletal strain, and and osteoporosis. With the can't afford to miss is quadus equinus syndrome and a possible tumor, either metastatic or primary. Because of the concerning neurological changes, I would like to refer her immediately to have an MRI and a neurological or a neurosurgery consult. If that can't be arranged, alternatively, we could send her to the emergency room to have it done in the immediate future. In the meantime, I would write a temporary prescription for tramadol for pain relief at home, and educate the patient on the risks and benefits of medication like that. 25 milligrams Q4 to 6 hours as needed for pain control, just for pain unrelieved by rest and Tylenol. And then diagnostically, I would also like to do a mini-cog or MMSE for the patient. She demonstrated some forgetfulness during the examination, and reported her sister has a history of Alzheimer's disease. And educate the patient on the treatment and need for further evaluation from this point forward, and then have her follow up with us in 1 week to coordinate with the recommendations regarding the MRI results and the neuro recommendations, and look at symptom management and further treatment plan.